Happy Health Writing Wednesday, y'all. Today, I'm going to be sharing with you the 5 tools and strategies. So, some of them are going to be tools, some of them are going to be strategies that I used to become a better freelance health content writer when I was just starting out. Now, if you have not tuned into one of these videos before or are unfamiliar with my background, my name is Megan Freeland, and I'm a public health pharmacist by training. But most of my work revolves around medical and health writing and specifically health content writing. So I started freelance health content writing back in 2016, 2017. And I currently run the Health Professionals to Health Writers program, which teaches fellow US based pharmacists and other healthcare providers how to replace a portion of their income through freelance health content writing. And every Wednesday, depending on the season, I do these Health Writing Wednesdays videos to talk a little bit more about health content writing, specifically for those fellow health professionals who might be interested in pivoting, transitioning, adding something unique and fulfilling onto your professional trajectory. So today specifically, I am going to be sharing these tools, resources, and strategies, however you want to categorize them, as some reference points for you so that you can start to consider in your mind what tools, resources, and strategies might be useful to you if you are considering pivoting or into or exploring health content writing. So as you listen to this list, please feel free to leave comments, ask questions, ask follow-up questions, anything in the comments. You can always comment the word waitlist if you are interested in joining the waitlist for the next cohort of health professionals, health writers. And I'll make a special announcement about that towards the end of the video. So make sure you watch all the way through. And as I talk about these tools and strategies, I'll share in advance that you will probably start to notice a pattern. So we'll talk a little bit more about that pattern towards the end as well. For now, we can go ahead and jump straight into the list. So the first thing that helped me improve my writing skills as a newbie freelance health content writer was setting aside dedicated time to practice writing. There is fortunately an endless amount of information on the internet about various types of writing, including content writing, including medical writing, including health content writing specifically. And back in 2016, 2017, when I was starting out, there was no resource like health professionals, health writers that I had to be able to follow and say, oh, these are the steps that I need to take. So I'm going to follow these steps and then I'll be good. That didn't exist, which is part of the reason why I created Health Professionals, Health Writers. What I had to do was spend a lot of time digging around the internet, trying to figure out and put together information, and then a lot of time with trial and error, just trying to see what worked, what didn't work, etc. Because there was a lot of time that was needed to do that research and gather that information. And if we're thinking about today, there can also be a lot of time that it takes to learn and gather information. If you're trying to do it on your own, it can be easy to spend all of your free time collecting information and very little time actually putting pen or pencil to paper and writing and practicing. And the time that you actually spend practicing and writing is the most important thing when it comes to improving and progressing as a writer. There is no way that you are going to reach your full potential as a writer if you never actually take the time to sit down and write. And one mistake that I see some healthcare providers who are interested in writing opportunities make is they spend 100% of time on trying to gather information and trying to learn, this skill or learn this information or learn, fill this gap in knowledge that they might not have, but they don't actually spend time writing and doing the skill and practicing the skill that they're trying to learn. So being really diligent about setting aside time to practice, I think was really important in the earlier stages of my freelance health content writing journey and is really important in your early stages as well. When students are coming through the accelerator program, they're not only filling in the knowledge related gaps that they might have when it comes to health content writing, but they're spending huge chunks of time, and they will tell you that this is true. They're spending huge chunks of time actually writing and actually practicing as well. So that's number one. Don't skip out on that. The second thing, I guess, strategy, I'll call this, that was really helpful and that I recommend to all writers, regardless of skill level, is taking time away from a piece, then going back to it, rereading and self-editing my work. So to say that a little bit more concisely, allowing time to pass after you've written a draft of something, then going back to it and editing it again. When you set aside the time to practice and to write, it can be easy to like get in that hole and then just spend hours and hours or days and days working on this piece and perfecting it and improving it and making changes, et cetera, to the point where you almost like can't read it anymore. Like you just can't process any new information in regards to what you work. And it's just because in regards to what you wrote, and it's just because you've been in it for so long. You've been in it for hours, in it for days, and your brain is just too close to what you've written. If you don't have the benefit of having someone else who's able to edit your work and able to help you identify areas of opportunity for improvement, what can be a really helpful strategy is to take a break from it. Just let it close the computer, minimize the tab, because you don't close the tabs. Minimize the tab, leave it alone for a few days, ideally, like 2-3 days. If you don't have that much time, maybe just, overnight or a couple of hours or so, but walk away from it, forget about it, don't think about it. And then when you're ready to come back to it, reread it out loud and do a self-edit at that point. Even taking some time away, ideally, you have someone else with a fresh set of eyes who can come in and offer some feedback. But even if you just personally step away and take some time away from it, then when you come back to it, you can at least have a fresher perspective so that you can identify those areas of opportunity for improvement. That will be of tremendous benefit. Again, whether you are a newbie, a beginner, or whether you are, working with plenty of clients and have lots of client work. Now that brings me to my third resource, which is a great editor. A great editor, if you have access to one, is going to teach you so much about becoming a better writer. I think sometimes there is like tension between the writer and editor, or perceived tension in the writer-editor relationship, because some writers let me back up. Okay, writing is a little bit science, a little bit art. How much of each kind of depends on what you're writing and how you feel about it and how you approach your writing work. But because of that, it can be very personal. And when you put all the time that's required into creating a piece of content, such as an article or a blog post, in the case of most freelance health content writers, when you put as much time into that as you do, you can be very protective of the words that you wrote down. And so when you're working with an editor and they come in and make all kinds of changes and suggestions and comments and just slash your article all up, it can be like a little bit, it can be a little bit striking and a little bit difficult to handle, depending on, your approach to the writing and your relationship with the editor. In my experience, having a phenomenal editor has elevated my writing skill in ways that I don't think would have been possible had I not had that experience with a wonderful editor. It wasn't someone I chose. I didn't, go out and find a personal editor. I just kind of lucked up and wrote for a client that this editor worked for, and she was assigned to my work. And we probably worked together for 2 years, around 2 years, consistently. And there's something that is different about an editor's eye in comparison to a writer's eye that is invaluable. And so if you ever have the opportunity to work with an editor who has that eye and has the knack of being able to clearly communicate what suggestions they're making, why they're making them, right? Not just the what, but the why, so that you can understand that thought process and then apply that to your future writing. That has been hands down one of the best resources that I've come into as a writer. And if that is an opportunity that you have as a newbie or early on in your freelance health content writing journey, definitely take advantage of that editor relationship that you have. The fourth, I don't know whether they call this a tool or a resource, that I found was incredibly useful was thick skin. Um, and this is kind of related to the previous resource with the editor, because again, if you're taking things very personally, it can be difficult to really extract as much value from that writer to editor relationship as possible, because I think it kind of clouds your vision and ability to like think objectively about the work and not just subjectively about it. But the thick skin also applies to a lot of other elements that are a part of the freelance health content writing journey that I don't think are always top of mind for healthcare providers who are interested in freelance health content writing. So there's the writing part of it, but there's also the freelancing part of it. And that is essentially a business, right? You're essentially creating a business if you decide to become a freelance health content writer. That means that you're responsible for generating interest in your services and securing clients who you can actually write for. And that process is, for most people, if you've never run a business before, it's something new and it's something different, and it requires a different way of showing up and confidently putting yourself out there. That is something I find can be challenging for certain types of health professionals. I will say pharmacists are one of them, because we tend to be more so the behind the scenes, operational, I just want to help people type of people. But that thick skin and that willingness to step out into the forefront and be proactive about the opportunities that you want to be a part of, that is absolutely necessary. When you have conversations with prospects who you want to be clients in the future, being able to take charge of those conversations, to lead those conversations, and not just, let the other person decide what you're going to talk about and what you're going to spend time on. All of these things that are not necessarily top of mind when healthcare providers first start thinking of freelance health content writing, they are all required. They are all a part of the process. And having a thick skin is going to be beneficial for every element of that process. It was something that I had to work on. It wasn't something that I had immediately, but as I worked on that and as I improved it, I felt like more of a business owner and less of a freelancer, right? Because there's a difference between those things. So that's number 4. And then lastly, the 5th tool/strategy I used to become a better writer was just reading a lot of other people's work, whether it was blog posts and articles. It was a lot of blog style articles, because if you're trying to get better at a certain style of writing, it helps to get really, really deeply intimately familiar with that style of writing. So reading blogs and articles in existing publications, but also reading content that would not necessarily be considered blog content writing. So news articles and journal articles and et cetera, just reading a lot of other people's work. I think that the skills of reading and writing are closely tied together, and it's something that we are taught as children, right? We learn how to read and write, and those skills kind of intersect in a lot of different ways. But I think it becomes less it becomes less obvious as adults, especially if you're in a field that doesn't really require writing a lot and then you're trying to transition into writing. It can be easy to forget that reading is like an essential and foundational component of being able to write really well. And so if you have opportunities to peruse, health related magazines, health content publishing sites like your, WebMDs and Healthlines of the world, et cetera. If you have colleagues or friends who are health content writers and you have opportunities to read their work, do that, because as much as you can get familiar with the style of blog writing, that's going to help. That is going to help further your ability to adopt that style of writing as well. So here's what I hope you noticed from this list of 5 tools and strategies that I found helped me become a better freelance health content writer when I was a newbie. A lot of what I talked about here is intangible in certain ways, like the thick skin, the letting time pass, the time to practice. These are things that require some internal work and grit and perseverance. And that's not to say that if you aren't like 100% committed to pursuing freelance health content writing that you can never do it. That's not to say that at all. But I do feel like it's important to make clear that a lot of the steps are what the steps are, right? The steps are what they are. But if you don't also have the internal motivation and the internal will to push through and to progress and to improve, then your success as a freelance health content writer is going to be less than it could be if you did have that internal motivation and you were really committed to setting yourself up for success in multiple ways, not just going through the motions to say, oh, yeah, I learned this thing. Oh, yeah, I picked a niche. Oh, yeah, I knocked out this article real quick so that I could have something to show when a prospect asked me for samples. Oh, yeah, I reached out to a couple of people here and there. Nobody responded. So I guess, it's just not going to happen for me. Following the steps is one thing, but deciding that you are going to commit to making it work no matter what, that's a whole nother thing. And so that might be of all the things that I listed, the other 5 kind of tools and strategies I listed, above all else, I think maybe the mindset that I had at that time when I first started out, which was, I know this is possible. I know because I accidentally did it. Like the first time I did it, it was accidental. It wasn't on purpose. That's how I know that this is possible. Because I know that this is possible, I'm not going to stop until it works. I know that if I keep pressing forward, if I persevere, that I'm going to be able to secure clients, that I'm going to be a better writer, that I'm going to, whatever my goal is. So I think above all else, what was most helpful was the mindset that I was going to keep working the steps until they worked. And I think that is my best suggestion for anyone who's tuning in, whether you're someone who is taking a DIY approach to figuring out how to become a health content writer, or if you're someone who has come through the Health Professionals to Health Writers Accelerator, or is interested in enrolling in a future accelerator. That's above all else my advice to you. If it's something that you're going to commit all the way as extensively as you can, and make sure that you're able to create space internally in your life for all of the intangibles, because it's not just about following the steps. It's also about making sure that you have room and space to grow and to persevere and to push forward. So I'll get off my soapbox now because I can go on, but I'm going to pause here, and I hope that message came across clearly for folks. Now, I mentioned that I would share an update regarding the Health Professionals to Health Writers Accelerator wait list. There's currently a cohort going on right now. They've been in the program since January, and the next cohort, which is the last cohort of the year, The accelerator program is 6 months. So there's one cohort in January. There is one cohort in July, which is the next cohort that's starting up. Those are the only two cohorts of the program that are going to be happening in 2023. And so if you have an interest in joining the accelerator this year, you're going to want to apply for the July cohort. As a reminder, the accelerator program is currently only open to US-based pharmacists and other healthcare providers. Students, residents, and fellows are not eligible due to the time that it takes to move through the program. And when applications open for the program, they only open to the wait list first. So folks on the wait list will have the first opportunity to apply and enroll, which means that if you are interested in joining the July cohort or applying for the July cohort and you are not yet on the Health Professionals Health Writers wait list, you want to comment the word wait list so that you can get on it. Because I will fill up the cohort with folks who are on the wait list before I open applications to the general public or providers who are not on the wait list. So make sure that you leave that comment if you're interested in joining. And I will see you for the next Health Writing